Lesson 8. Communication and relationships in schizophrenia. Schizophrenia is not an illness that lives only in your head. It also affects your everyday life, your relationships, conversations, family situations, work, household duties, and even the simplest exchanges of words. A sensitive, overloaded mind that is prone to interpretations reacts to contact with people more intensely than a healthy mind. Every word, tone, gesture, or look can trigger tension. That is why the ability to communicate your needs and experiences is one of the most important therapeutic tools. It is not about talking a lot, it is about talking clearly, calmly, and in a way that protects your peace of mind. Communication in schizophrenia has two main goals. The first is preventing misunderstandings, which often act as triggers for symptoms. They create tension, frustration, guilt, hurt feelings, or the belief that others mean something by it. The second goal is creating a space in which you can receive help when you need it, before the tension rises to the point where symptoms start to intensify. People do not read minds, even if they love you. If they do not know what is going on, they may react in ways that are difficult for you. Skillful communication reduces this risk. One of the most important parts of a conversation is talking about your experiences without fear or shame. It is completely normal that sometimes you do not want to talk about your symptoms. You may fear judgment, you may fear that someone will not understand, or you may simply not have the energy to explain. But avoiding conversations means that your loved ones do not know how to help you, and you are left alone with the tension. That is why therapy teaches simple, short sentences you can use when you are feeling worse. In everyday life, they work better than long explanations. You can say, for example, "Today the noise inside is louder for me. I'm overloaded and I need a few minutes. I'm having a hard day. Please don't ask for details, just be here." These do not have to be long descriptions. A signal is enough. In relationships, it is also very important to speak about your boundaries. In schizophrenia, emotional boundaries are often unstable. Sometimes you react too strongly, sometimes too weakly, and sometimes you do not feel your limits at all. Then conflicts arise easily. The ability to say, "I can't talk right now, I need some quiet, please don't speak to me in that way," is not aggression, it is maturity. It is behavior that protects your brain. In MCT, metacognitive training, they even say a patient should treat their boundaries like a barrier against overstimulation, the way a person sensitive to sunlight treats sunglasses. Boundaries are protection, not selfishness. It is equally important that you learn to interrupt conversations that hurt or overload you. You do not have to take part in an argument that is causing you pain. You do not have to explain yourself to someone who is not trying to understand. You have the right to say, "This conversation is exhausting me, let's come back to it later." That is not running away, that is emotional stabilization. Your brain needs calm. And calm is more important than proving you are right. The Buddhist approach to communication says that true speech is speech that leads to peace. It does not exhaust, it does not wound, and it does not inflame the chaos of the mind. Sometimes, however, the problem appears from the opposite side. It is not what you say, but how you interpret what others say. Schizophrenia can create the impression that people are saying something between the lines, that their tone is suggesting something, that their gaze has a hidden meaning. In such situations, it is often easiest simply to ask, "Am I understanding you correctly? Did you mean something different? Could you say that in another way?" Most misunderstandings disappear in 1 second when the other person explains their intention. Without asking, the mind fills the silence with its own interpretations. And interpretations, especially when you are tired or stressed, rarely work in your favor. Communication also matters in your relationship with a caregiver. To make your cooperation effective, it can help to create a few shared codes. This might be a single word or gesture that means "I'm overloaded," another that means "I need help," and another that means "please don't ask me anything right now." Then both of you know what is going on, without needing long conversations in difficult moments. Many families use such short signals. They are gentler than arguments and more effective than silence. As you learn to talk about yourself, it is important to remember one thing: you do not have to justify your illness. Schizophrenia is not a fault, not a choice, and not a weakness. If someone does not understand you, it is not because there is something wrong with you. It is because that person has never had your experience. Instead of fighting for acceptance, it is enough to speak honestly and briefly. Those who want to understand will understand. Those who do not want to will not understand, even if you talk for hours. Communication with your doctor and therapist also needs simplicity. You do not have to describe everything. The most important thing is to say what has changed. Are the symptoms stronger? Are you sleeping less? Do you have more anxiety? Are the voices more intrusive? Therapy is based on honesty, but honesty does not mean revealing everything, only what is relevant. Your relationship with your therapist is a place where telling the truth does not lead to judgment, but to help. Buddhist wisdom says that speech should be true, gentle, and useful. True, in line with what you really feel. Gentle, in a way that does not hurt you or others. Useful, leading to understanding, not to more chaos. If you bring these 3 qualities into your communication, you will notice that relationships become calmer and symptoms weaken, because stress no longer has the same power. Communication in schizophrenia is not about forcing yourself to talk. It is about choosing the right words at the right moment, building bridges to people instead of walls, and talking about yourself in a way that protects you rather than exposes you. Over time you will see that conversation can become a space of peace, not a source of threat. This is a skill you can learn step by step until it becomes a natural part of your life. Therapeutic communication, models, techniques, and ways of speaking that protect your mind. In schizophrenia treatment, communication is just as important as medication and daily structure. It is not about talking a lot, or even talking about everything. It is about speaking in a way that does not start a spiral of stress, neither in you nor in the other person. Good words have power. They can calm the nervous system, interrupt rising tension, soften interpretations, and stop symptoms before they grow. That is why most professional therapeutic programs teach patients specific communication techniques. These are not artificial assertiveness rules, but practical tools meant to protect your mind from overload and from distortion of what is being said. One of the most common methods is the stop, think, speak model. In simple terms, it means stopping your reaction before it becomes too intense. Stop is the pause, noticing that you feel an emotion, but not reacting yet. Think is checking whether what you are hearing is an interpretation or a fact. Only then comes speak, a response that is usually much calmer because it does not come from an impulse but from a brief moment of reflection. In practice it looks like this: someone speaks to you in a sharper tone and you feel the tension rising inside. Normally you might reply immediately, sharply or defensively, and the conflict would grow. With stop, think, speak you make a short pause, usually invisible to others. In that moment you check, is the answer I want to give based on what is really happening, or on the tension in my body? Only then do you answer. A technique this simple can stop an avalanche of stress that otherwise might turn into symptoms. Another important method is communication built from 3 sentences: I feel, I need, I ask for. This technique is used in CBTP and IMR because people with psychosis often describe situations as if they were facts, not feelings. Instead of saying, "He is provoking me," you can say, "I feel anxious, I need a moment of calm. Please give me a little time." This way of speaking protects you from building false interpretations and reduces the risk that the other person will hear your words as an accusation. Talking about feelings instead of about other people's supposed intentions helps you avoid conflict, and the mind stops creating extra meanings. A key part of therapeutic communication is also the ability to ask questions when you are unsure. Schizophrenia often creates a sense that people are implying something, that their tone, gaze, or gesture has a hidden layer. Instead of trying to read into what might have been suggested, you can ask, "Can I check that I understood you correctly? Did you mean something else? Could you say that more simply?" This way of communicating is called decoding intentions. It is the opposite of mind reading. Every question you ask reduces uncertainty and, with it, the risk of interpretations that could trigger anxiety or paranoid associations. Research shows that asking simple clarification questions can reduce delusional interpretations by as much as 40%. Communication is also linked to working with cognitive distortions, which often appear in schizophrenia. The most common ones include personalization, they are talking especially about me; negative filter, this person doesn't like me; mind reading, she thinks I'm weird; catastrophizing, this will end badly. These biases are not symptoms in themselves, but they can act as catalysts for symptoms. That is why in therapy you learn to express your own feelings rather than assumed intentions of others. Instead of saying, "I know they're judging me," you can say, "I feel tense when they look at me like that." The difference is subtle but fundamental. It protects you from sliding into paranoid conclusions. One of the most practical tools is the withdrawal statement, a way to interrupt an overly intense conversation without fueling conflict. It might sound like, "I'm overloaded, I'll come back to this conversation later." "I can't continue right now, I need some quiet. Let's talk again in half an hour." Unlike an outburst or suddenly walking out, a withdrawal statement does not worsen the situation or make the other person feel attacked. It is a technique used even by crisis intervention teams, because it is effective and protects both sides of the conversation. In communication, tone of voice and body language also matter. In schizophrenia, the brain is hypersensitive to social signals. A tone can seem harsher and a gesture more forceful than they really are. That is why therapy teaches you to speak more slowly, more quietly, and in a calmer rhythm. When you slow down, your nervous system begins to settle. And when the body calms, the mind calms too. It works both ways. Gentle speech makes the other person respond more gently, so the conversation does not escalate. In crisis situations, de-escalation communication is used. It means using short, very simple sentences, avoiding irony and jokes, not raising your voice, not stepping too close, and giving the other person space. If you feel that someone is overloading you, you can say, "Please give me some space," or "I need 5 minutes of quiet." If you feel yourself winding up, sit down, drop your shoulders, and speak more slowly than usual. Your tone affects your nervous system. When your tone is calm, your body does not send a signal that there is danger. There is also the safe technique: slow, ask time, focus, exit. Slow, speak slowly. Ask time, ask for time before you respond. Focus, focus on the meaning of the conversation. Exit, if you need to, step out for a moment without breaking the relationship. Safe is not refusing contact, it is regulating it. It allows you to maintain connection without overload. Most important of all, do not expect perfection from yourself. Communication in schizophrenia is difficult because your brain intensely filters social signals. That is why every technique, a pause, a question, a request for time, a statement that you need a break, is an act of wisdom, not weakness. It is a way of caring for yourself and for relationships, which can be your greatest strength in recovery. Stigma, self-worth, and speaking about your illness. Schizophrenia carries one more burden that is rarely talked about openly: the burden of stigma. In many societies, this illness triggers fear, misunderstanding, and stereotypes that have nothing to do with medicine or reality. That is why so many people hesitate before sharing their experiences. They are afraid of rejection, ridicule, tactlessness, or even coldness from the people they love. This fear is understandable, but paradoxically it is silence that deepens loneliness and intensifies symptoms. Stigma works like a mirror that distorts your image. It makes you start seeing yourself through the lens of other people's prejudices. In therapy, patients are taught that stigma is not the truth about them, it is only a mistaken belief held by society. Schizophrenia does not mean being dangerous, weak, or inferior. It means having a sensitive brain that needs more care and stability. Communication is a tool that helps to heal your relationship with the world, but also with yourself. When you talk about your experiences in a calm and wise way, you gradually rebuild your sense of self-worth, independent of social labels. The most important thing is to know that you do not have to hide who you are. You only need to learn to speak about yourself in a way that protects your peace, not in a way that exposes you to judgment. You have the right to define yourself, not the illness, and not society. Summary: It is worth saying clearly something that for many people with schizophrenia is the greatest source of relief. Schizophrenia is an illness like any other. It is not a moral failure, not a choice, not the result of weak character or lack of willpower. Just as no one chooses pneumonia, cancer, diabetes, or thyroid disease, no one chooses schizophrenia. It is a biological condition, largely genetic, that develops independently of your wishes, plans, or intentions. You can have great mental strength and still become ill. You can be sensitive, ambitious, kind, and reasonable, and the illness may still develop. That is a medical fact, not a judgment. Understanding this has huge importance for communication, because many people with schizophrenia carry an unconscious sense of guilt. They are ashamed of their symptoms, ashamed of how they sometimes react, ashamed of what they do not understand. Yet shame and guilt are secondary emotions. They do not come from the illness itself, but from the pressure of the environment and from how society views mental disorders. Letting go of this burden is one of the most beautiful steps in recovery. When you realize that you are not responsible for having developed this illness, communication with others becomes easier. You stop explaining yourself, you stop hiding, and you begin to speak about yourself with simplicity and calm, as about something that is part of life, not a mark of disgrace.